co-host, Dr. Shani Davis.
Hello, hello. How are you?
Fabulous, fabulous. And how are you? So we have a lot. You can answer that question. How are you, Dr. Davis?
I'm amazing. I am amazing in this COVID season. I can't get away from it. I'm fully vaccinated. I'm encouraging my patients to get vaccinated, even tabling the need for standard adult vaccines. You know, if you need a pneumonia, if you need a tetanus or whatever, I say, let's put all of that to the side. Let's get this COVID vaccine done first.
Well, thanks. Well, thanks for being a catalyst and certainly pushing me to get it done. But in all fairness, I was really waiting for Dr. Davis's office clinic, Your Best You, to have the vaccinations, and we were going to do a live vaccination on the show, but I had to go ahead and get it done.
That's exactly what we want people to do. As soon as you get an opportunity to get vaccinated, that is the way that we're going to be able to flatten the curve, per se. We don't want the virus itself to have a vector, a place to mutate, a place to multiply, a place to go and jump to the next person. We don't want to be a spreader of the vaccine. In my clinic, we have been ready since probably about a month and a half
Okay.
now on the Florida shots, and we're registered and ready. However, for an office, the best vaccine is the one that can be kept in a standard refrigerator. Remember, the Pfizer and the Moderna did some ultra cool conditions to remain viable. Now we get the Johnson & Johnson news, which is the one that could be kept in a standard.
Well, apparently you're going to have a show. That is a show in of itself. But today, this month, we are super, super excited because it's about us. It's about our culture, information that we need to know and be able to disseminate. And this show, Let's Talk Business with SJC, and my co-host, Dr. Davis, bring you the best of the experts who are at the top of their game in their respective fields. National, minority, even if you're looking at disparities, all of that kind of helps us to bring awareness to Minority Health Month. And that becomes very, very important. And with the help of Dr. Davis and our partners at Moffitt Cancer Center, there's a lot that we're going to talk to you and speak with you about today. Not only are we bringing awareness to National Minority Health Month, we've got to also look at another situation that's just affecting our culture, and it's also bringing awareness to STD. We'll talk a little bit about that. Dr. Davis will chime in a little bit on that. We will not waste another minute.
All right. Yeah, we won't waste another minute. Just want to make sure that we are still live and going. If we are still online, that is an amazing thing. Not exactly sure if we are. We must be.
Oh, I think we okay. I see we are back live. That's the beautiful part about going virtual. When stuff happens, we just keep moving. So In Touch is communicating with us. We're live. We're all back. And let's just dive right in. So in case they missed it, our special guest today is Antoine B. Richards. He is a research project specialist for the Department of Thoracic Oncology at Moffitt Cancer Center. Now, what that means, he's been there working in that field for over a decade in the healthcare sector, including public health, community outreach, public affairs, and research. He is a doctor of science. That's a capital D, capital S, little c, candidate in emergency management at Jackson State University, where his research interests included intersection of public health and emergency management, social vulnerability, social determinants of health, community resilience, community capacity building, and sustainability. If that's not enough, additionally, he is the former advisory board member of the Georgia Trauma Foundation and currently co-leads the Diversity, Equity, and Racial Inclusion Initiative for the Association of Healthcare Emergency Preparedness Professionals. A native Atlantan, Richards relocated to Tampa in 2019 and was inducted into the Emerging Leaders of Tampa Bay in 2020. Congratulations.
Thank you.
Now, today, he serves as the 2021 Inclusion Group Co-Chair. He received his Master of Public Health degree from Morehouse School of Medicine and his Bachelor of Science, his BS degree in Communications from Kennesaw State University. Now that's a bio. I must ask, how does one decide that this is what they want to do as a professional career? What led you to becoming the researcher that you are, Antoine?
It was, and thank you first and foremost. Thank you both for having me on the show. I really appreciate this opportunity to discuss this very important topic, and a topic that I've discussed on plenty of occasions throughout my public health career. I think what really drove me to this particular area of research is just the work that I've done throughout the years. So I worked at Grady Hospital in Atlanta, and at the time it was the only level 1 hospital, level 1 trauma center in Atlanta. And I did a lot of work out of Grady. But one of the things I realized as an x-ray tech, I did x-rays and CT scans, was that there were a lot of people that were affected. We had a certain population that would come through Grady. And Atlanta, it's one of those cities where obviously, there's a lot of diversity there. So we definitely see a lot of those different populations, but it always got my mind wondering about, where are we going? How can we make an impact here? So when I finished my bachelor's degree, I said, all right, maybe a master's in public health would be good. And I focused on health policy in particular.
Okay.
And Morehouse School of Medicine is really cool because it's one of those places where you can actually sit on campus with former Surgeon Generals. So Dr. David Satcher operates right out of Morehouse School of Medicine. Dr. Daniel Dawes operates out of Morehouse School of Medicine, who was instrumental in writing a lot of the policy for Obamacare, or the Affordable Care Act. So it was just a lot of really good experience there in research and community-based health approaches that we took that really turned my eye to research in that sector. And as I finished up my public health degree, I took a public health preparedness course, and I was volunteering for the American Red Cross at the time. And I said, this will be a really good opportunity to go into emergency management. What happens after disasters? When people have to evacuate, or they have to seek shelter? What if they're diabetic and they can't get their medicine? Do they pass away because of it, or is their healthcare delayed? If they don't have access, what happens? So it was like one question went into the next question, which went into the next question, and I just kept getting degrees to go along with all my questions. So,
well, you know what? It may have turned your eye, but it also caught the eye of so many other professionals. And let us take this opportunity to congratulate you, sir, as being the former Dr. Bill Jenkins Achievement Award recipient for exceptional academic achievement and volunteer experience in public health, and what you do in striving towards knowledge and skills and abilities to improve outcomes and vulnerabilities based on populations through your servant leader. Now that's a new term in and of itself, servant leader. And as we're reading about what it is that you've already accomplished, and just listening to you talk about it, we can see and hear the passion in your voice that you love what you are doing.
Yeah, it's definitely very exciting. Any chance I have to make a difference, or to, like, the point that you made about servant leadership, that's really big to me. It's a way that, you give back through your leadership, and you focus on really getting involved in the community and working with community members and things like that. And being new to Tampa, it was one of the things that I was really looking forward to. It was a new city, and then the pandemic happens, and
then and then the pandemic happened. Well, listen, my co-host actually has something to share. The two of you now are working together in the community, shall I say?
Yeah. I actually, I've been on the board for the Central City YMCA. We call it the YMCA Urban Core board now, and I'm on the Healthy Living Committee. And two meetings ago, last month, actually, yeah, Antoine was introduced to our board and committee. And as I read through and heard his bio and passion, and heard him, speak about it, and just got a sliver how he came to Tampa, I just got excited in the most, I guess, cerebral way and nerd and health way possible. I'm like, wow, someone that is, so community connected that it was, working in the community that fueled, academic questions and the desire to make a difference and, work in these disparate areas from, advocating for, changes in lifestyle to reduce risk for health disparity, for cancer prevention, for research, and how do we connect more with people that are disparately affected by certain conditions. And just listening to him, I said, man, I got to get him on this show somehow. And lo and behold, here we are. Here we are.
And here we
Here we
are.
are.
Here we are. And I'm so glad that connection was made, because this is the show that will be all up in your medical business. And when we're out there in the community and we're listening to individuals and we're hearing that, wait, this is something that our radio listening audience needs to hear, or this person needs to be a part of the show. And fortunate for you, you're already with the Moffitt Cancer Center, which we have had. You are probably now the fifth, I believe, fourth or fifth expert that's come on the show to talk to us about what Moffitt is doing. And you guys are going to hear these terms, bringing awareness to Minority Health Month, but you're going to hear inclusion and equity and disparities and how all of that comes back and affects us and our radio listening audience. We started the show talking about COVID-19. 15 months later, we are still having the conversation, still talking about where we are. So the theme for National Minority Health Month is #vaccine ready.
Yes.
So I can say fully vaccinated. Yes, 2 doses, Pfizer. I'm truly past my 2 weeks and everything. I am truly vaccinated. And when we think about that and we think about where we are, so to you, sir, as a senior advisor for the Institute of Diversity, Inclusion, and Equity in Emergency Management, and right now this could be considered emergency management, what barriers to care and access are most important to address in getting more African Americans vaccinated against COVID-19?
Yeah, in that role, it's really the level of engagement that we do. So in so many ways, we say we want to target these communities and target these communities and target these communities. And then when you ask, well, what are we doing in the community? The conversation kind of stagnates a little bit, right? This doesn't mean that, a lot of places aren't putting forth efforts, but it's about connections. So making community connections. Definitely vaccine hesitancy is a real thing. It's out there, but also when you start to think, or at least in my head, when you start to think sometimes about some of the younger populations that may not be as aware of, the Tuskegee syphilis study or things like that, then you start to question, well, what about that population? And millennials are some of the more hard pressed to not get the vaccine, So you start to say, well, there has to be a reason why we're still not connecting beyond the historic reasons that we used. So in my role as senior advisor with IDEM, one of the things we look at is what entails that community outreach? How do we build those connections? When we start to write like equitable vaccine distribution strategies or plans, do we look at faith-based organizations? Are we doing door-to-door campaigns? Are we going to local, places that are out there, instead of just saying, hey, we put the messages out there? Are we going to the,
There may have been an interference.
Actually, we are still on board. There's a pause on with Cheryl, but I hear you absolutely.
Antoine, we had a little disconnect for a minute there, but I see that
you, Cheryl. It's just you, Cheryl. So.
Oh, well, excuse me. You know what? Then this would be a perfect segue if the difficulties are happening on my end. We wanted to hear about that because again, we were talking about these terms. I'm hearing you talking. I'm talking about you having a conversation about collaborative. You're having a conversation, when it comes to strategic planning. You're having a conversation about what this means. We're talking about capacity. I want to delve more into the conversation about the clinical component. And that's where we bring Dr. Shani Davis in of Your Best You Clinic, and she will help us kind of further engage into the conversation and what exactly organizations like Moffitt Cancer Center and others can do in helping us to engage and educate people who are considered a health disparity when it comes to minorities. Dr. Davis?
Indeed, indeed. Antoine was sharing that the first things first. He's been at Moffitt for about 2 years now, and his expertise in connecting communities with care is where Moffitt and our community will benefit most. I think he is a perfect liaison. Just before the technical difficulties, he mentioned connecting by meeting people where they are, faith-based initiatives, and he was speaking about some other things too. I remember Moffitt at one time was even doing like a barbershop research,
Yes.
and even Dr. Guede, talked about using some federally qualified health centers to increase, connections with and awareness for minority participation in some studies, because we do need that insight. So if you don't mind, I'll continue talking about that, Mr. Richards, how Moffitt and in your experience, connecting with the community in a maybe blending social paradigms with clinical paradigms have been effective. And then I have a question after that.
Yeah, sure. So I think just picking up where we left off, or just to kind of sum it up just a little bit, we have to be intentional, right?
Yes.
About what we're doing. Intention is everything. So not only do we have to, say we want to reach these communities, but we actually have to do it. And we have to be intentional about how we do it. One of the things I can say, just with my experience here at Moffitt, I happen to sit on the Thoracic Honors Inclusion, Diversity, and Equity or TIDE initiative. And I also work on or help co-lead the Minority Accrual Task Force for my department. So what I really want to focus in on there is that Moffitt is intentional about what they're trying to achieve here, with saying that there is a clinical component to research and things that we have to look into, and we want to make sure that we're reaching out to the public, but then also make sure the public has the access and opportunities to achieve the things that are needed to improve health outcomes. And in my short time here, I've definitely seen a lot of, invested kind of initiatives and things come together in committees that focus on that. And it's been really enlightening to see those things move forward and actually take, more motion too, even over the last year. So.
Indeed, indeed. So again, I think you're just a jewel to the Tampa community, and I'm just so happy to have I've met you and looked at your body of work. So for Minority Health Awareness Month, the CDC and the Office of Minority Health nationally has focused on vaccine readiness, and you've already alluded to some of the resistance in our community for this vaccine. Of course, it's really important because we see higher mortality rates and higher morbidity rates after COVID infection. And some of this has to do with the social determinants. And you have, lots of experience in there that I want you to talk about. So what are some of those social determinants of health that put African Americans at such high risk for a COVID infection?
Yeah, so social determinants of health, it's a very broad but also a very specific term, right? It's kind of the same things that we talk about or that we experience, and when we begin to talk about social determinants of health, we might not even know we're talking about it just in normal conversation.
Mhm.
Hey, I can't afford to do this right now, I gotta work, or I'm working two jobs to do this thing, or I don't have the time to do. All of that is social determinants of health. I want to eat healthy, but a salad costs $10 and a 2 for $5 is $5. This is what I can afford. That's social determinants of health. Or my family's from Southern Georgia, so I had a cousin that's taking online classes right now because of the pandemic, but her internet isn't that strong. So she's like, I got to stop school right now because I don't necessarily have the access or the internet coverage that I need to do it online. That's social determinants of health, right? If you're
Yes.
riding down the street and you don't see grocery stores in your neighborhood, that's social determinants of health. And then when you start to look more level of education, income, family, culture, society, where you fit within that society, all of those things are social determinants of health. And these are things that we talk about in everyday conversation, right?
Yep.
So when we look at that from a public health standpoint, though, we really assess all of that. We say this is this. Here's in this area, social economic status is one thing. There's lack of restaurants here. There's a food desert, and all of these things come together to create what we know as chronic diseases. So high blood pressure, obesity, diabetes, and we see that more among minority populations. And a lot of that has to do with trends we see in social determinants of health. And the big thing, as we're talking about COVID and vaccine ready, is that the same things that we have argued for, heart disease, diabetes, even cancer, we're seeing with COVID. There were still disproportionate impacts of COVID on people of color, and communities of color. So those are the things that when we start to look at, we have to say, if we really want to improve, we have to be intentional about getting to the root causes of social determinants of health. And that's where that conversation of equity versus equality comes in. Because
Mhm.
equality is just saying, hey, we provide care and you can get it.
There you
But
go.
not everybody can get to that level of care that they
Right.
need. So equity is really about meeting you where you are, which again, getting into the community and being intentional about meeting the community where they are and bringing them to a level where everybody has access to what it is they need. I often say this, and I'll kind of stop here, but I often say that, until we get to a point where we can't say that, blacks are 2.1 times more likely to die from this type of cancer, or Hispanics are 3.2 times more likely to die from this type of cancer. Until we can get past that and just say that cancer is killing people at a this is what cancer is doing, and not it's more or less for one race or one gender, then we haven't achieved equity and there's still work to be done.
Absolutely, absolutely.
Wow.
And I think it was just so important that you connected those dots on what social determinants are in our community and how that increases our risk. So just as you said, it's the heart disease, it's the obesity, it's the poverty, the close living quarters, having to choose, what kinds of foods that you eat. If we're gonna have like all rice and beans and turkey necks, just to kind of stretch it out or whatever, all of those risk factors for obesity and heart disease, etc. Those conditions likewise put us at risk for cancer. Those things are what make the outcomes with the COVID infection amongst those, with those chronic diseases at higher risk for mortality. So this is why, National Minority Health Month has focused on vaccine readiness. We're talking about saving, our communities here. We got to be proactive as well when we're talking about minority health. It isn't always about the reactive approach of curing. We have to take a proactive approach in preventing. On this side of the hour, we'll talk a little bit more clinical on after the commercial break, but I do want to talk about what can we do to reduce our risk for these chronic diseases. Chronic diseases, as you know, are pro-inflammatory. And it's the whole inflammation cycle which has made COVID so, awful. So pro-inflammatory conditions put you at risk for cancer. They put you at risk for death. They put you at risk for infection. How do we prevent the pro-inflammatory conditions of obesity and heart disease? What can we do? And in your experience, where has there been, good success?
Yeah, that's a really good question. So, some of this is genetics and we can't downplay that, right?
Yeah, we can't
But
modify those things.
yeah.
Can't choose your
but
granddaddy. Yeah,
uh,
I said we can't modify those things. We can't choose
yeah,
your granddaddy. Yeah.
exactly. But the other part about it is a lot of chronic disease or a significant percentage of chronic diseases are based off of our risk behaviors, right?
Mhm.
So what we eat, how we eat, do we smoke? Do we drink a lot? Are we active? Are we getting the right amount of physical activity? Those are things that we can do to really reduce the chronic disease burden. And I always say this, or we say this in the emergency management side of thing, that today's disaster is tomorrow's catastrophe, right? So if we don't, even if we were to look at Hurricane Katrina and the outcomes of that, if we don't properly mitigate or prepare for the next disaster, we're going to have Hurricane Katrina again. It's probably going to be worse, right? So think about that in terms of health. If we're not eating right today and we're enjoying all of the fruits of the food, I love hot wings. I'm not going to lie, that's the Atlanta in me. I love it. But but I do know that my decision, if I was to eat hot wings every day today, will likely result in a very expensive healthcare bill down the line, i.e.,
A
blood
disconnect.
pressure, diabetes, things like that. So we have to be cognizant of those things individually, right? Of
Okay.
what we're putting in.
Let me interrupt you just for a little bit. I was peeping through your LinkedIn page and I saw that you were the public affairs specialist with the Fulton County CDC, a cool program called Pitch. Um, I'm sure Moffitt looked at some of those same things, and it's what attracted, them to your profile. Tell us about some of the things that you did, up there and how those things can help a cancer, someone that's at risk for cancer, maybe from that family, from their family history or from their lifestyle, that can help reduce those risks because that also can help reduce risk for their COVID morbidity and mortality.
Absolutely. So Pitch was a really cool program. It was a CDC funded program, and I worked with it through the Fulton County Board of Health. And for those who don't know, Fulton County seats pretty much the greater Atlanta area in Georgia. So one of the things that that program was dedicated to was active living, healthy eating, and tobacco cessation. We had three separate programs running under that one particular program at any given time. So as a public affairs specialist, my job was a lot of putting out the messaging. Anything that came in and out of that program ran through my hands, and whether it was on the news, commercials, all that good stuff. But what was really cool about this program was getting out in the community and doing a lot of the work. So we were able to convert bars and restaurants to tobacco smoke-free bars and restaurants. We were able to pass a proclamation for a Great American Smokeout Day in the city of Atlanta and in the county of Fulton. We were also able to convert all parks and recreation facilities to tobacco smoke-free facilities. For healthy eating, what we did was we implemented school programs. So a lot of the daycares, we helped fund a lot of daycare centers. So we caught the kids early while they were 4, 5, 6, and we funded healthier food options. So brown rice, mango slices instead of chips and things like that. And we educated them on healthy eating. What we found through that was that a lot of kids would go home and say, "Mom, I want the Cheetos." They say, "Well, do you have mango slices?" Because we had mango at school. And
That's awesome.
parents are like, "Well, where you get mango? Because we ain't never bought mango before." But that's how you do it, right? The other thing for active living we did was really focused on faith-based organizations. So we created interfaith active living programs. We met with all types of faith-based organizations. So not just churches, mosques, we met with
Yes.
synagogues, we went to all of them, and we helped to implement walking programs. And what they would do is once, twice, three times, some churches did 5 times a week. The congregation would meet at 5 and they would walk the neighborhood together. And
Mm.
what they found was that a lot of people were getting more active. They were getting that 30 minutes of physical activity. Those that wanted to run had running partners. So it really boosted their social aspect as well as their health aspect. And the other thing that I found really interesting that was kind of an unexpected benefit of that was that one of the reasons a lot of people, especially in certain communities, I know the community I grew up in was the same way, don't get out and exercise. It's not safe, or maybe the lighting isn't good, or maybe there's not sidewalks. These are all social determinants of health, right?
Right, right, right.
Um, so getting out with your interfaith group in groups of 5 or 10 or 20 or 30 made a lot of people feel safer,
Yeah.
and it built that connection. So we found that that was kind of one of those effective things that, wasn't written into the plan to come out of it, but it really helped benefit a lot of things. And we were able to implement so many different policies and changes that it warmed my heart to do that work. So
Well, you're warming our heart just sharing that information with us. And listen, as you were talking, I was listening to you talk about the problems that we're having with obesity. And if you go back, and I'm talking to colleagues of mine as a result of COVID, present company included, we've been tossing this term around about the quarantine 15. But when I was doing the research for the Minority Health Month, and this number, and Dr. Davis can attest to this, and we could talk a little bit about it on the other side of the break. But part of their motto was get active and stay healthy during the month of April. That's just laying the foundation to get it started. But the numbers, adults, 1 in 4 are inactive. And that pattern is now transcending down to our students, in high school students, it's 1 in 5. So we're spending a lot of time in this was before COVID, by the way. We're spending a lot of time indoors. Our young people are not getting out, being active, getting exercises. So to hear you talk about those programs, I know we're going to talk on the second half of the show about action, the action plan. And as you all were talking about social deterrence, I was in a meeting last night with the city of Tampa, East Tampa CRA. And after interviewing over 500 plus, just under 600 individuals, business owners, and residents in the Tampa Bay community, but specifically the residents. And the problem was violence. So they're in communities where they can't go outside and just maybe take a walk around the community. And there's so many things that we just take for granted. And so when we come back after the commercial break, I know you're going to talk about delving into that a little more, but that obesity is now a problem as a result of COVID. And us being stuck in our homes. So we're going to take a commercial break. Feel free to pop your logos up, and we'll take a break for about 2 minutes. And once we come back from the break, Dr. Davis is going to come back because she's now all up in your business, but she wants to talk about what's going to happen as a result of COVID-19 and what's happening with infections, what's happening with all of these underlying conditions that you all alluded to earlier, what's going to be the action plan. So we'll see you back after the break.
CJ, and I want you to listen to Trap Talk Radio at 8 p.m. every Thursday right here on In Touch News, www.intouchnews.com.
Hello, Kubo. What have you got planned for today?
Come on, this way.
Adventure can be found anywhere, but the best place to start is in the forest.
It's the most powerful magic there is.
Head outside to discover incredible animals.
Wow.
And beautiful plants that come together to create an unforgettable adventure. So grab your loved ones and explore a world of possibilities. Visit discovertheforest.org to find the closest forest or park to you. Brought to you by the Ad Council and the U.S. Forest Service.
My teacher said that we should have a plan in case of an emergency. Do we have one?
First thing I'm gonna do is grab a flashlight with dead batteries.
I'm going to start randomly throwing clothes in the bag. You two will be hiding in the closet and Dad won't be able to find you.
And that's when we both start crying.
Uncontrollably. Can you pass the cutlets?
Winging it is not an emergency plan. Make sure your kids know what to do during an emergency, who to call, where to meet, what to pack. Search Ready Kids at nyc.gov or call 311. Brought to you by the New York City Office of Emergency Management and the Ad Council.
By now, we're all aware of the dangers of COVID-19. Like others with existing health issues, cancer patients are at a high risk due to their compromised condition. If you are newly diagnosed with cancer, your care likely can't wait. Moffitt Cancer Center is the best place for your cancer concerns and to provide guidance to help you plan your next steps. We're here for you. Call 1-888-456-2839 or go to moffitt.org/here-for-you.
And we are back. Thank you so much. Welcome back to Let's Talk Business with SJC. I'm here with my co-host, Dr. Shani Davis, and our special guest, Antoine B. Richards, one of the research specialists from Moffitt Cancer Center. You know, at the break, I was listening to a commercial, and it was a Moffitt commercial, and the commercial was talking about one of the underlying conditions being cancer and what's happening with those cancer patients as a result of COVID-19. So before we took a break, you mentioned how when you looked at preparedness and when you look at today's tragedies and how to keep that from becoming tomorrow's catastrophe. So here we are, we're with COVID. And just so that you know, and you were talking about disseminating this information out, let me just say a thank you to our Facebook family. We have those individuals that take their lunch breaks with us every Wednesday. And as a result of that, the show is streaming live on Facebook. So thank you. So share, comment, if you will. The other thing is the show is also, you'll be able to pick it up on YouTube. You can pick the show up live from In Touch News. And as a result of that, the beautiful thing about it, Mr. Richards, is that people can come back and look at the show tomorrow. In Touch News will air the show again later this week, usually on Friday. So we're putting the information out there. We are taking a proactive role in making sure that we bring the experts here. And at any point in time down the road, you have access to this information. So we're coming back. We're talking about these underlying conditions, how they are affecting African Americans and minorities. And as a result, they're more likely to die. Yes, from COVID-19. The numbers are down today. They were staggering just months ago, but because of these underlying conditions that you all have already spoken about, obesity, diabetes, and heart disease and smoking, to you, Antoine, what are some ways the public health sector can proactively mitigate these conditions that can help us now?
Yeah. As we were going to the break, it made your last final comments brought up a really interesting story to me. So I remember in one of the neighborhoods I grew up in, they came out and did a community assessment, right? And they said, we wonder why obesity is high in this area, A, B, C, and D. Then they went out and said, all right, well, maybe because there's no sidewalks, right? So the city went and invested, I want to say it was somewhere around $7.2 million to put sidewalks within that neighborhood that I grew up in. And then about a few months later, they went back, reevaluated, and said nobody's using the sidewalks. They then decided to have a community town hall and asked the community why they weren't using the sidewalks. And the community member said, well, there's no street lights and it's not safe. So, all that goes to say that it ends up being a waste of time and money a lot of times if you're not reaching out to the people that you're trying to serve, right? So that's one of the big things that really take away from there is that we got to be, again, intentional. You got to know, that's where research comes in a lot of ways, what is the problem and how can we fix that problem? And we want to inform that with data. Policy can't be changed without data. And that requires not only community feedback, but, numbers from what's really going on. And I think where we miss the ball at a lot of times is not necessarily looking at that community feedback because they can help guide you to the right approaches, in ways that will be most beneficial. You get the best return on investment in your money or you get the best outcome from your policy.
And also your time and your time too.
Yeah. Oh, definitely the time. Time is the one thing we can't get back.
Get it back.
Let me use that as a segue because what the theme here, what we've been talking about just before the break and on to now is moving from awareness to action. And the most important thing that I got from your last statement, Mr. Richards, is that you got to assess first. We first have to assess to see what is needed. And that's what starts the research process. So, and this transition from awareness, to action, just in our conversation, your experience has attracted Moffitt, a leading cancer institution. And in this vein of cancer awareness, that prostate cancer is one of those things that minority men, particularly Black men, experience more of in terms of mortality. We get more prostate cancer, slightly more prostate cancer, but we get much more deaths in prostate from prostate cancer. Your CV told me that at Clark, HBCUs, you did some prostate research. Can you tell us about that? And then I'd like you to talk about things that Moffitt's doing to help get the word out about cancer awareness, because it is one of those things. All kinds of cancer, indeed, are more prevalent, at disparate rates in our community. So tell us about these things.
Yeah, so my work at Clark Atlanta, I helped to manage the National Prostate Cancer Registry. It was a self-reported registry for prostate cancer survivors to really go in and tell us their experience with prostate cancer. And through that, we looked at 3 different areas or targeted 3 specific areas, mainly around health-related quality of life, their clinical experience, and then their emotional experience or spiritual experience, right? And we really dove into that. So we managed to get well over 1,000 responses, and we constantly recruited for people to just come in and share their experiences with us. And we were able to use that to really help advocate and tailor our approaches for community outreach. So how do we outreach? How do we engage? What decreases, their health-related quality of life or HRQOL? What factors contribute to that? how much does sexual health contribute to that? Because with prostate cancer, you look at erectile dysfunction and things like that. How does that impact you emotionally and spiritually? So we were able to look across so many different factors. And when we went out and did community health fairs and did recruiting, or when we spoke about prostate cancer awareness, we were really able to let that data guide some of the ways that we approached a lot of the different things. And I mean, we put out a lot of outreach. We coordinated with basketball teams, football teams. Being at the university, we had blue out days where the football games, everybody would wear that prostate blue, even though the school's colors were red and black. And it was just, a really powerful statement to doing that, much like how we do with breast cancer awareness, and, the wearing of the pink and things like that. But there are certain areas that we could really do a lot more of, and prostate cancer was one of those areas. So again, we were really intentional about the data and understanding those experiences and trying to translate that into something that was actionable. Same thing with lung cancer. Lung cancer, where I work in now, has, very significant mortality rates and incident rates. But you don't necessarily see as much of a push in lung cancer. In my opinion, lung cancer, their color is like this white. So I could just see a real nice whiteout for lung cancer or something, but you don't see it, right? But it impacts people of color in a very big way. So those are the things that I also look at within my roles and say that, when we look at outreach and engagement, man, lung cancer it's right up there with prostate and breast. So how can we improve awareness for those different things in the manner that, they've done with other forms of cancer? And again, that just takes, intentional action. So, again, when we look at the things that Moffitt is doing to raise awareness, I'm sure, that the commercials that are on TV right now, I mean, they're out there really raising awareness for, clinical trials and to get a lot of positive things done. We have a Center for Outreach, Equity and Engagement, COENE, which does a lot of phenomenal work that really breaks down disparities in communities and identifies priority cancers and priority populations and things like that to really help guide where we're looking for future awareness and outreach efforts. There's a lot of different committees that are coming together, some, within the department, some Moffitt-wide, but you're starting to see this integrated approach towards making sure that we can do significant outreach and awareness. And I think it's a powerful thing there. And it's backed, to my happiness, it's backed a lot by data and research, because you need that to, again, influence policy.
Very good.
Yeah, I think that's one of the big things. And the other thing I definitely look forward to too is more community-based participatory research.
Yes.
That's a thing where we get out into the communities and it's almost where the community becomes the partner in your research. They're right there
Absolutely,
with you.
absolutely. And we certainly want to play an intricate role in that. And that's why we have the show. We talk to you about being all up in your medical business, but this is a show where you can actually have the conversation. When we're in the studio, we normally take call in so that we can hear from our radio listening audience. We'll be back in the studio soon, Dr. Davis.
All right.
But for now, we're all vaccinated now. We're doing the show remotely. And so when I hear you talk about this new group, and the fact that Moffitt has this outreach community, I'm interested in hearing more about that, because we feel that this show is one of a great platform to be able to have experts like you come on, but one in such that as you're sharing this information, there could be hundreds of thousands of people that couldn't hear it today, but they can catch it an hour from now or a week from now, or enjoy it as they're going through their weekend. So we feel that we certainly play a very, very important role in making sure that we disseminate information out into the community as well. We do that because it's our responsibility. And to hear you, and on a side note, it's hearing you talk about lung cancer. And I lost my mom to lung cancer, mesothelioma. She actually never got a chance to go to be treated at Moffitt. It was such an aggressive disease that we knew nothing about. Apparently, it could have been dormant in her system. It was mesothelioma. Could have been dormant for 30, 40 years. Who knows? But whatever brought it to the forefront, once it was diagnosed, it was super, super aggressive. And I thought, man, I know so much about breast cancer, and I've participated in outreaches and so much about prostate cancer. Knew absolutely nothing about lung cancer. And you are absolutely right. Today, the numbers are just so high. And this is why outreach is so important. But it's important because it's got to reach the people who are not getting the messages for whatever reason, social determinants and whatever. But Dr. Davis, you go ahead and take on the clinical aspect of it. But it's nice to hear that I'm hearing more now about lung cancer and how it affects our community.
A quick segue on that point, Cheryl. I think it is important that we, do something, consider something that can raise awareness of lung cancers that are not smoking related, because they do tend to be much more aggressive. And then with Moffitt being right here in our backyard, there's assistance, and there are ways that they connect with persons that are uninsured and underinsured. Moffitt does have those, and Dr. Guetta even talked about a little of that last month. I want to table that part though, and go back to what Mr. Richards was saying about data guided approaches to designing tailored or to tailor community outreach. When the community, through community participatory research, with community-based participatory research, you get insight almost like at the ground level to tell you what the people want. And then you actually design the research around what the people want. And then you get the people to help you implement what they took part in designing. And that goes back to connecting the community with the science for better and more specified outcomes. So it really is a win-win when we allow researchers into our conversations about things that concern us in our community. And I just want to again just applaud Moffitt this time for bringing on the jewel of Mr. Richards to help with those things. Quick segue though. April is also Sexually Transmitted Infection Awareness Month. And sexually transmitted disease is so prevalent in the African American community. We don't talk about things so much for sometimes cultural reasons, but those are conversations that need to be had. Blacks account for about 42% of all of the new HIV cases. And these are data from the CDC 2018, most current statistics that I'm citing here. Chlamydia cases amongst Black women are 5 times the rate of white women. Gonorrhea in African Americans is 7.7 times higher. Syphilis cases are 4.7 times higher the rates of what we see in whites. So with that said, if we don't, talk about, sexual health, we will continue to see disparities in our community. Another STI that's not talked about as much is, genital warts, and that's caused by the human papillomavirus. About a decade ago, there was a lot of talk about, oh my gosh, particularly, people amongst, faith-based community. Let's not have, our healthcare providers, advocating for our little girls to begin having sex early by having them vaccinated. More than 70% of all Americans has, or at one point had, some strain of HPV, and not all of them are cancerous. Not all of them cause warts. Sometimes they're just there. But there are some strains that are extremely, likely to cause cancer. And that's what that vaccine Gardasil that initially was indicated for young ladies between the ages of 11 and 26 was for, to help suppress, those tendencies. Moffitt Cancer Center, a scientist at Moffitt Cancer Center, started to investigate that, because of course they have to have sex with somebody to, women have to have sex with someone to get, these high rates, and to have it, be at the rate that we see nationally. But those rates are less because of the science that came out of Moffitt Cancer Center. I think over the past 2 years, that indication has now gone up to age 45. And this would prevent HPV cancers like in the throat, on the genitals, and in other places. So with that being said, tell us about what you know about sexual health cancers and any campaigns that Moffitt has to increase awareness of prevention methods in minority communities where the prevalence and incidence are most high.
Yeah, I'm gonna definitely start it off by saying that, when it comes to sexual health, it's a really important conversation always, and it's one that is often avoided, unfortunately, just because of the stigma around it. Do we want to talk to our kids about sex at 6, 7, 8 years old, or not? I mean, you even kind of see it embedded into the policy. That the rated R, that we hide the nudity from them, or it becomes really taboo. Whereas sometimes overseas, I know it was really interesting to see this when I was in France, but there were condoms in vending machines. You're like, well, that's weird, but maybe not, right? Because now everybody has access to it. It promotes good sexual health. And it kind of helps remove that stigma there. So, that's one thing. The other thing about a lot of the STDs, and this goes even with high blood pressure, diabetes, lung cancer. When you look at lung cancer, a lot of people don't see it until late stage. These things are silent. A lot of them are silent. High blood pressure is known as the silent killer. You don't know it until it's too late. If you're not getting yourself regularly seen, if you're not getting your regular physical checkups, if you're not getting your blood pressure checked. And the same thing goes with a lot of those STDs, that they can be very asymptomatic until they've kind of, really spread to a point that you say, all right, I got to get assistance, and it may be too late. And HPV is one of those things where it may be asymptomatic, and even men can get it, and a lot of men don't know that. And then there's the stigma around, oh, I got HPV, I'm not a woman. The same stigma we used to hear about the AIDS epidemic and homosexuality back in the day. I can't have that, I'm not homosexual. Or those are things that we have to focus on better education and better awareness to remove, because until we do that, it makes it really difficult to have the conversations and to really say that this is how we can improve upon those things. As far as HPV goes, Moffitt's Dr. Giuliano has done a lot of work with that, particularly in the Gardasil 9, and how it can protect women from even some of the more harmful strains of HPV, and is also doing some work in looking at the immunogenicity of that among men. That is powerful work. When we talk about data and things like that, having that research and being able to understand these vaccines and how they work, or what the importance of having them, and having that data to support it, can really improve awareness campaigns and outreach campaigns. Being able to see those numbers decrease over time and things like that, or seeing the impact that is made, is going to be really important. And I think that's one of the really big significant contributions. Not only does Moffitt do a really good job of putting out that research and saying, here's what we found, these are ways that we can improve, but they're really supportive of the researchers and the people that are doing it, and hopefully trying to make sure that it's translated not only from clinic, not only within the clinic, but from clinic to practice.
Yes. So, what is Moffitt doing to try and get better minority representation in the clinical trials that are ongoing? Moffitt's always doing something, if it's just, doing that qualitative part, asking about, the experience, or if it's literally, intervention. Moffitt's always has some kind of research going on. What are they doing to make sure that we have more minority participation in the studies ongoing and in studies to come?
Yeah, so one of the big things looking at that is, we have to look at research. We have to look at what's going on around the nation too. So the issues with minority clinical trial accrual is not just a one spot thing, right? This is all over. It's really hard to get minorities to participate in clinical trials. Part of that is clinical trial education. Part of that could be distrust. There are tons of different reasons. So again, being intentional about using what we know, looking at what other people are doing, what other models are effective, but then also working within to do that. So, Moffitt has the Respect Committee, which does a lot of work that is dedicated to improving racial and ethnic minorities in clinical trials. Again, in my role, I sit as lead of the Minority Accrual Task Force for Department of Thoracic Oncology. So I'm constantly integrating with our different departments, sociology, our COE&E, which is again our Center for Outreach, Engagement, and Equity. And we're talking about ways that we can improve accrual, talking about ways that we can be more intentional about, reaching out to the community, because the work has been done, but, there still has to be that connection, and we have to manifest that. And here's the thing, doing this work is not just a one-time thing. A lot of times people come in and they say, well, we did this and we reached out to the community and there were 500 people there. But trust isn't built in a day, right?
Mm.
You have to be consistent and intentional about these things. And one of the things that I really value here at Moffitt is that not only am I doing, my work within my department, but to see it Moffitt wide, these committees come together and these different alliances and things work together and look for long-term strategies that shows an investment in long-term community engagement. And I think that that's going to be something that you'll start to see a little bit more of over the years as things come about, because it's not just they have it and it's going to work today. It's going to take time.
Absolutely. So you've mentioned several of these acronyms and committees, but RESPECT stood out to me. Respect Committee. Tell me about this Respect Committee, and I'm hoping to hear more about how that committee impacts the community.
Well, the committee is it's really a connection of a lot of the physicians and other people that have a vested interest in increasing again clinical trial accrual. So we've been able to look at a lot of racial disparity data, again, identify priority cancers and things like that. So a lot of these coordinated efforts now, physicians from each department, people that have a vested interest in seeing better accrual have come together, and they're looking at it from educational aspects, from research aspects, from clinical aspects, from outreach and engagement. There's so many different departments and teams that are working within that committee to really make sure that we can translate point A to point B to point C to point D. Getting that stuff planned is a tall order, but it's a necessary thing that needs to be done. So working to coordinate and plan, and again, you got to think it's a very interdisciplinary approach, and we need that, right?
Yes, we do.
Because healthcare is a very interdisciplinary field. So
Yeah.
being able to, look at it within that committee and say, well, here's so and so from the Department of Thoracic Oncology, and here's GU, and here's prostate, and here's our outreach and engagement. Here's a couple of social workers, and we're able to really take a good look at a lot of the things that are going on. And being a part of that committee has really been informative in tying in the work that I'm doing in thoracic, but then also looking at the projection of the impact that can be made down the line. So that's the power behind that particular committee.
That's
Well,
lovely.
you know what? You know what? I must give a shout out to Moffitt, because before the pandemic, actually a year before that, part of the outreach and engagement committee, there was a program that you all had for the HPV that we participated. They were going around to a number of the churches and organizations, and they were having private groups, like no more than 25 or 50 individuals. And they came in and did a whole awareness training on the actual HPV, and as a result of it, how that affected our children, what was the best approach, and having a conversation with your young girls. I hope the program is still going on. I know I participated in it twice, and they went through some of their local churches and organizations. But it's things like that that we need to, and I think the only reason I was involved is because I knew a lot of people at Moffitt, and so they were able to call on me in order to help pull these groups together. But then outside of that, I wonder how many of these programs do we really know? How do we know about them, and how can we make sure that our community is engaged? But let me take this opportunity, Mr. Richards, to thank you for enlightening our guests today on what you're all about, the pivotal roles that you are playing right now with Moffitt. And I'm hearing you say, we're having the conversation with a number of these different departments. We're just looking forward to hearing more about the action component, having the conversation, but where the programs are, and something that you will hopefully come back and be able to share with us. But let me go ahead and get your final thoughts, and then we'll get Dr. Davis's final thoughts before we wrap the show up.
Yeah, my final thoughts really, take care. Take care of yourself. And in doing so, it takes care of others. And again, be intentional about it. Um, again, the decisions that we make today are going to impact us down the line. So, be cognizant of it. And I'm not saying don't live your life. I'm just saying, be cognizant of the fact that, there are some things that we can do to improve our own personal health or create better habits. It's always about self-improvement, just like it is about learning. We're always finding ways to improve ourselves and to learn down the line. So never stop that. Never stop improving, never stop learning, and continue to become your best you.
All right, your best you. Perfect.
See the plug there?
I love that. I love that. I love that. I love that. And in being, I love that so much. Wow. And in being our best, and in recognition of National Minority Health Awareness Month, we may not be going after that Johnson & Johnson vaccine right now, but it's still really important to get vaccinated. It's really important to get vaccinated, and also taking those steps, just as Mr. Richards indicated, to reduce our risk for even incurring chronic diseases that put us at greater risk for morbidity and mortality should we incur a COVID infection. April is also Sexually Transmitted Awareness Month, so do your part. Learn how to put yourself at least risk when engaging, and also getting the appropriate vaccines to prevent viral and other infections such as the HPV vaccine. Also, make sure that we're exercising and eating healthy. The last thing I want to say is that when we do have cancers, it could be a sexually related cancer like a cervical cancer, a lung cancer, an obesity related cancer, a prostate cancer. Cancers affect minorities at disproportionate rates, just as we see in diabetes and heart disease and obesity and things like that. Moffitt Cancer Center is right here in our backyard. And we keep saying Moffitt because Moffitt has these awesome professionals that keep, enlightening us and coming on our show and gracing us with their time. But there are programs for the uninsured and the underinsured. Ask your healthcare professionals on the Moffitt website to see, what we can do to take advantage of those community benefits. They have lots of committees and things, and I know that there are ways that the community can be engaged on those committees. So if there is information that you can share with Let's Talk Business and In Touch News Weekly, we can post those things as we close out. Make sure that you revisit the show, share the show with your communities of influence. I'm Shanae Davis with Your Best You.
All right, and thank you so much. Remember, it's National Minority Health Awareness Month. Stay active, stay healthy. Thank you both. This show is a wrap.